So today I wanted to speak about Elon Musk and his prior cervical disc replacement at C5, C6. A disc replacement, for those who are not aware, is an artificial implant that's put in from the front of the neck and allows a patient to maintain motion, bending forward, side to side, and by rotation. This surgery is done for patients who have stenosis, which is a narrowing of the spine, or for a disc herniation causing pressure on the spinal cord and the nerve root. Now, we all know Elon has been training for his supposed fight with Mark Zuckerberg, and during that training, apparently he became symptomatic and a repeat MRI of his neck was obtained. Now, Mr. Musk has been on social media stating that his cervical disc replacement has failed. Now, what do we know about cervical disc replacements? Well, we've been using them for over 20 years in Europe and at least 15 years in the United States. And the data is very convincing. Disc replacements don't fail from the wearing out of the disc material, the plastic spacer that's inside. So what can we surmise is going on with Mr. Musk's neck? More likely than not, he probably has residual narrowing in the neural foramen. That's the space where the nerve roots exit. And because a disc replacement is a very technically challenging operation that preserves motion, that motion may be causing that narrowing and buildup due to bone spurs to cause irritation in the neck and the arm, leading to arm pain. So what are the options for Mr. Musk at this point? Well, the first option could be a replacement of the disc that's been put inside, taking that out and cleaning the bone spurs, and a new disc replacement can be inserted. And that would be done through the same incision in the front of his neck. Another option could be one that is done endoscopically. An endoscopic procedure is one in which a small camera is inserted in the back of the neck. And then the facet joints in the back where the buildup of bone spurs could be cleaned out with the camera. You can think of this as similar to a knee scope done for an ACL. At the end of the day, what we do know is that Mr. Musk's treatment, if indeed he is symptomatic, is very treatable and can be done either through the front with a new disc replacement and cleaning out the bone spurs, or done through a small camera less than half the size of your fingertip in the back of the neck.